Eleonora, just like yesterday, she'll help you out, she'll show you around, and she'll answer any questions that you have. The others, I'll give you 2 other mentors, don't worry.
Follow me here, start with the entrance.
You're around the university, if you're welcome to ask any questions that you may have. And it will take maximum 1 hour and a half. Yeah, enjoy.
Hi everyone. Okay, so like she said, I'm Cheryl, 5th year medic, so I've been here for quite a while, so if you have any questions, feel free to ask me, okay? So we're going to start by going in that direction that we're going to now. Your kids won't be there very often at this point in time, but they'll be there when they get to like my year, 4th year, 5th year, 3rd year. Let's just be careful. Maybe move them. So yeah, I just had a question from this parent here about how the study is like and whether it's like the UK. If I'm being honest, it's not really like the UK. The study here is more traditional in a sense, so it would follow more of the schematic of like how Cambridge, Oxford and Leeds, I believe, do it. So it's a traditional method. So the first 3 years are more theoretical, less clinical, and then when you get to 4th year, it's purely clinical. So even me as I am now, I'm barely on this campus. I'm mainly at the hospital. We've got hospitals like here as well. So here behind us, we have the hematology department. We've got radiology over there as well. And on that side where we started, we had internal medicine. So we have like rheumatology there, and we've got respiratory diseases and everything there. In the first year, everything, like I said, is going to be more theoretical. So in first year, all your kids will be doing subjects such as physics, chemistry, biology to build that foundation of scientific knowledge. What else do we do? We do anatomy as well, which I'll show you that department later. Do anatomy, and we also do cytology, histology and embryology as well. So these are more theoretical, less clinical for now. Yeah. And the pharmacology department here, where we do this in 4th year and 5th year. So as I'm in 5th year, I've just done my general pharmacology part 1 this summer, and then I'm doing clinical pharmacology now, which I'll have that exam in the winter. So it's split into 2 parts over the year basically. So we have the summer exam and then the winter exam. Yeah. Does anyone have any questions about?
This is your final year?
No. So this is a 6-year course.
Yeah, so, I know the 6 years. Is it not supposed to be like FY1? Your foundation
so
year?
yeah, so it's placements, but we're still here, so it's still like our final year. This is my final year of like doing exams like this, and but in the final year it is like yeah, so it is like FY1. We'll be doing placements, and it's structured a bit differently. So how I'm doing it now is that we learn throughout the year, and then we have either summer exams or winter exams. So now that we've just started, we've just started in September. We'll learn some of the shorter subjects. So for example, clinical pathology will be done now, and that will be done, my exam, in January. However, some of the longer subjects I started last year in September, dermatology. So I've done dermatology, didn't do the dermatology exam in summer. I'll be doing the dermatology exam next summer. So some of the courses, the subjects that we do are longer, some of them are shorter. Yeah, and then in the final year, so 6th year, we do placements, and then we do the corresponding exam at the end of that placement. So one department might have a placement which is 1 month long, and then you'll do the exam after that. Some of them will be 2 months long, and then you'll do the exam after that. So it's more separated in the final year.
So your graduation is at the end of your 6th year,
yes,
essentially. And
yes.
what courses do you do at the 6th year?
So we do a lot. I can't think of all of them from head, but we definitely do this thing, social medicine. So that's how it's kind of like public health.
Community medicine.
Exactly. So we do social medicine, we do all of the normal stuff like pediatrics, internal medicine. Internal medicine is like a lot of different subjects obviously combined together. I've done my first internal medicine exam in 3rd year, so that was the more general basics of it, and we did that in that building that we just started at, I just told you about. That was in 3rd year. That was part 1. Part 2 was done this year, and that combined, I always forget, but it combined rheumatology, cardiology, hematology, and something else which I don't remember, sorry. But it was a lot of studying, so it was like 4 subjects in one. And then now I'm going to do the 3rd part, and then in 6th year you'll do the 4th part, because obviously internal medicine encompasses a lot of subject.
So the 7th year, do you have to do it in Bulgaria, or you can do it abroad?
So
after graduation?
Oh yeah, after graduation you can leave, you can stay, you do, so you're free to do whatever you want after you graduate.
So the UK considers this
done FY1 here, it won't be combined. So in the foundation program in the UK, of course you'll have foundation 1, foundation 2, but here if you choose to do FY1, you would have to reapply again for FY2, which is why our 6th year counts as FY1, and then you can apply straight to FY2. That was our pharmacology department. Here we have clinical oncology. I haven't been in that building yet because I do it in, later in 5th year and then 6th year for clinical oncology. Here we have the pediatric building, which is why we have like the playground here and all of that stuff. Pediatrics is done in 5th year, so I've just started it. However, pediatric surgery is done in 4th year as a separate subject in itself. So we have, in 3rd year we have a subject called general surgery, which is the baseline. Then in 4th year we have special surgery, specialized surgeries, where it's split into 4 different ones again. Cardiovascular surgery, pediatric surgery, and this is so hard to remember, sorry.
Orthopedics, ENT?
Sorry?
Orthopedics?
No, orthopedics I'm doing now.
Okay.
It's a bit confusing. Half of my year group did orthopedics last year, and half of us are doing it this time. So last year instead of orthopedics, I did urology, and now they're doing orthopedics, but that wasn't like orthopedic surgery. It wasn't classed in that specialized surgery subject I just told you about. Yeah. And we were doing general surgery because we have different teachers who are also doctors and they have their own specialties. So when I was in 3rd year, my doctor who was teaching me was a plastic surgeon. So we got to be in the plastic surgery ward at the main hospital. So we got to see that, and then sometimes he'll take us to other places. We got to see surgeries as well. It's all split differently. So usually in 3rd year we start the clinical, but it's not 100% clinical yet. But we do the foundations of the clinical studies, and then we go into 4th year and it's another layer up. Then we get a bit more specialized, and then we go to 5th year, way more specialized. 6th year is just pure rotations. Yeah, pediatrics, oncology. We're not going to go in because a lot of we're just not allowed.
Yeah. And this is both inpatient and OPD?
This one is inpatient. Yeah. We have our science building, which we call the Hay building. This is where most of the first year students will spend a lot of their time here because, like I said, they do physics, chemistry, biology. This is where we have all those classes. We can head on in. We have some of our exams up in the classrooms, and when we're waiting for results, a lot of people wait here. You can also come here at any time, just chill, study here as well. We've got like a little secret study space here. There's only a few seats. We've got some studious people in there. It's just a little small one. You can just do that way. So in this building, so this tells us like what we have. So this floor is for physics and biophysics. Biophysics is done in 2nd year. physics is in first year. Second floor is for biology and biochemistry. So biology is in first year, biochemistry, which is much harder, is in second year. We have third floor as well, which also is for biology and it's for chemistry as well. I don't know why it's that, but yeah. So everything above it would be for chemistry after second floor and third floor. Okay, so we might have some classes going on. So you can have a gander around if you'd like. But this is all it is really. Yeah. So sometimes they have the same teachers for English and Bulgarian. Sometimes they have. I assume for the Bulgarian course they will have some like events where Bulgarian students and English students can mix. We have freshers as well. We usually have a party at the beginning of the year at this place called the Youth Hill. So it's a nice like it's a hill, of course, but at the bottom of the hill there's a little park. There's like an eating area. It's got like restaurants, food stalls and stuff, and we have like a party there, which is fully catered by the university. So all the floors in this building, they look pretty much the same. They all look like this. It's just that the biology classrooms will have microscopes. I think there are some microscopes in here as well. So biology rooms will have microscopes. Everything else is the same. You see Bulgarian students like wandering around everywhere because like us, they go to the uni, you see them from classes. Sometimes like they'll be here during the class and you'll get an extra during the class. You see them around. And you see them a lot in the hospitals as well because it's a big hospital. So of course you will see those different students from different groups and also from the Bulgarian course as well. Yeah, it's mandatory that we all do sports. They're not really lessons, it's more like you go there and we have access to facilities. The dental students, because there's less of them, they do it in this sports room here, which has basketball courts, just volleyball courts and all of that. But the medical students, they won't be coming here. They'll be going to the medical college, which is also part of our university. They would have to take maybe a cab or a bus there, so it's a bit further out. But it is like that because it's got way more facilities. So over there we've got badminton courts, 2 badminton courts outdoor, outdoor tennis courts, I think 2 or 3. A football court, we've got a running track as well. Indoors we have gym with gym equipment and table tennis tables as well, about 3. Yeah, we've got badminton as well. So it's got way more facilities because of course on the medical course. And to be honest, I prefer that one, even though you have to travel a bit more, it's got more. So yeah, that one is compulsory. You just go there and you do whatever you want when you're there. You just play whatever games you want to do. One time me and my friends were running that because we're doing races. We were like, you do whatever you want. And then at the end you get a grade. Everyone does what it is. You know, during the weekend. So I had mine on Saturday. Most people had it on Saturday and Saturday morning. But some people do have it on the weekday. Not as many. It's mandatory. Yeah. You don't necessarily have to go every week, but yes. So, like I said, we start that in 3rd year, and that is combined with different subjects. So we do radiology and imaging diagnostics all together. So where we were before, that was radiology. So that's where we had our classes. And because it's split up, for me, I had 1 semester of classes over there, and then I had another semester of classes in this department here. So this is an outpatient department where we do loads of imaging, and there's a lot of patients in here that need imaging, radiotherapy, chemotherapy, all of that. Also, this is for the same thing as well. So we do nuclear medicine, radiology, and imaging diagnostics. So the radiology part is obviously about how you do x-rays and looking at x-rays, interpreting x-rays, imaging diagnostics is more so to do with looking at CTs, looking at all the other imaging modalities and understanding what we're seeing and identifying structures and stuff, okay? And then the last one, which is nuclear medicine, is all about the physics of how it occurs. So we learn about, things like 99 technetium. I felt like that's all we spoke about in that year, 99 technetium. So yes, the nuclear med is more so this. Our newest building. So it's our newest building. It was built, I think, a year and a half ago or 2 years ago. I had some of my third year subjects here. So because of that, I actually don't know all of the subjects that are taught here. Some of the subjects, one subject I do know that's taught here is first year and second year Bulgarian. Obviously when I was here, this building wasn't here, so I did it elsewhere. I don't know what else is taught here, if I'm being honest. I don't come here a lot because I'm now in the 5th year. But I can look at that and see. So yes, we study hygiene, hygiene and ecology, which is this is a third year subject, hygiene. It's about standards in healthcare, so how the hospital room should be, what the standards of care are, things that can affect you either in occupational settings or just like in classroom settings. So you learn a lot about things like sound and maximum sound capacity, things about light, how much light is required to hit the eye, air quality. We learn about what hospitals require in terms of like the different types of hospital rooms, how much space, like the rights of patients essentially, how much space each patient should have, how much space should be between each hospital bed. We learn about all of that stuff in
Infection control.
Yes, exactly. So hygiene, this is not for us. Disaster medicine, so we do that here now as well. When I did it, I didn't have it in this building. I had it in one of the buildings we started at. So disaster medicine is a subject that is done it's done in third year. And as the name says, it's all about what happens in a disaster. So how we treat patients in a disaster when we don't have proper hospitals or we can't get to the hospital. You learn about things like medical stations, forward medical stations, what you do, how you tourniquet a patient, what you do when they're under rubber, all of that stuff. It's very clinical. And we also did like CPR training during the disaster medicine crisis as well. Learning about things like what happens when there's a tsunami, what happens when there's an earthquake, just disasters essentially and how we treat them. That was the third year. We also have the languages here. And yeah, I think that's everything for medics that's in here. Yeah. It's like a study section / section to chill out if you want as well.
Okay.
Faculty yesterday. Dental faculty is just there, you can see it from here. Dental students are mainly in that building, like they barely ever leave. And then when dental students are in 6th year, they go to this building right next to us, and that's where a lot of the patients come in. Like we've got specialized rooms there where they do a lot of procedures. We've got rooms in the dental faculty as well, like patient seats for dental procedures. But in 6th